Hey Dragon Slayers! Today's video is about type 2 diabetes drugs, how they work, and their side effects, part 1. So by now, you may be asking, can't I just take a pill for this? Well, of course you could. Given the prevalence of insulin resistance and its complications, it's perhaps not surprising that countless medical and surgical interventions have sprung up. Prescribing a drug is the most common regimen with insulin resistance. These interventions can improve the symptoms, but to varying degrees, they generally fail to address the root cause of insulin resistance. It is unfortunate, but also understandable, that most physicians' first recommendation is a drug. Before ever interacting with patients, medical practitioners will have had countless hours of pharmacological and drug mechanism studies, but may be harmful, but only maybe a handful of hours devoted to lifestyle. What's more, many patients prefer taking a drug to treating their symptoms rather than undertaking the greater effort of changing diet and exercise habits. Yet, in most cases, lifestyle changes can completely correct the problem. Still, it's worth understanding the available medication options. We'll look at the main drug options, how they work, and the accompanying risks associated with these drugs. So, this is going to be a series of me trying my best not to butcher these words. But we'll start with the first one, which is a class of drugs called glyphosate drugs. So, some examples of glyphosate drugs are Pharaxia, Jardi, Jardiance, maybe, Invokana, Sugalat, and Deb Ezra. I probably completely butchered that. So, what do these drugs do? This class of drugs lowers blood glucose by filtering it into the urine. Lowered blood glucose often results in lowering blood insulin. This can lead to weight loss and improved blood pressure. So, how do they work? All blood glucose is filtered in the kidneys. Usually, all the glucose is reabsorbed back into the blood. When blood glucose levels which reach an unhealthy level, such as that accompanies with diabetes, the kidney fails to reabsorb all the glucose, instead removing it from the blood and expelling it through the urine. Glyphosate drugs effectively increase this process by blocking the kidney's ability to move glucose back into the blood. The side effects are increased risk of dehydration due to increased urine production. Glucose in the urine feeds bacteria, increasing the risk of UTIs, which are urinary tract infections. Limited evidence of increased bladder cancer risk needs to be confirmed with additional studies. So the next class of drug we have is thiazolidinedione. I'm probably mispronouncing that, but they're also known as glitazone drugs. So some examples of these drugs are Actos, Avandia, Duvi, and Rezulin. So what do these drugs do? This class of drugs lowers blood glucose by allowing fat cells to divide, thereby pushing more glucose and fat into more fat cells. Though these drugs are effective at lowering blood glucose, insulin levels may not change very much. Instead, the drugs increase the number of fat cells using that insulin, effectively improving its efficiency. So, how does it work? Fat cells are just a few cells that require insulin for glucose uptake. Insulin resistance can hinder this effect by making the body grow more fat cells, also hyperplasia. the number of cells that pull glucose from the blood increases. So, what are the side effects? These drugs almost always increase body fat. From a whole body perspective, this isn't a great trade off. Getting fatter isn't an ideal solution to insulin resistance, but the drugs do reduce the blood glucose. So that's what I've got for you guys today. In the next video, we will go over part 2 of more drugs that are used to commonly treat type 2 diabetes and learn about their side effects and how they work. And remember, guys, that together, you and I will slay the dreaded diabetes dragon.